Today I'll be talking about cardiovascular health in older adults. This is such an important topic because heart-related conditions are some of the leading causes of illness and death in people over the age of 65. We'll explore the common conditions affecting older adults, the changes that happen in their cardiovascular system as they age, and how these changes contribute to diseases like hypertension and heart failure. First, we'll go over some common cardiovascular issues like hypertension and heart failure. Then I'll explain how aging changes the structure and function of the heart and arteries. Lastly, we'll connect these changes to diseases and complications we see in older patients. Older adults often have multiple chronic conditions. Hypertension is the most common, affecting nearly 70% of people over 65. High cholesterol and hyperlipidemia are also widespread and contribute to clogged arteries. Heart failure is another major issue, mostly due to structural aging of the heart. Many of these patients also have COPD, which makes the heart work even harder. Cardiovascular disease is the #1 cause of death among older adults. It also leads to frequent hospital stays and serious complications like strokes or sudden cardiac arrest. Even when it's not fatal, it can greatly affect mobility and independence. As we age, our blood vessels and heart muscle go through gradual changes. Arteries stiffen and become less flexible, increasing resistance and blood pressure. The left ventricle often thickens in response to this pressure. This is called left ventricular hypertrophy. In addition, the heart muscle itself becomes stiffer due to collagen buildup, making it harder for the heart to relax properly between beats. Functionally, the heart becomes less adaptable. It doesn't respond as well to physical or emotional stress due to fewer and less responsive beta-adrenergic receptors. This means the heart can't increase its rate and output as effectively as it used to. Also, stiffening of the heart impairs both how it fills and how it pumps, especially during times when the body needs more blood flow. On a microscopic level, the heart's muscle cells, or myocytes, die off over time. The remaining cells get larger to compensate, but this doesn't fully restore function. Fibrosis, or the buildup of scar-like tissue, also develops and stiffens the heart muscle. The image on this slide illustrates these age-related changes in heart tissue. With aging, arteries become stiffer due to loss of elastin and buildup of collagen and calcium. This leads to increased systolic blood pressure and wider pulse pressures, putting more strain on the heart. Another issue is endothelial dysfunction, where the inner lining of arteries can't produce enough nitric oxide, reducing the ability of vessels to relax and dilate. All these structural and functional changes increase the risk of conditions like HFpEF, where the heart pumps normally but doesn't relax properly. Arrhythmias are also more common because of changes in the conduction system, and many older adults experience dizziness or fainting as a result.
The aging heart's electrical system also slows down. Fewer beta-adrenergic receptors mean a weaker response to adrenaline, so heart rate doesn't increase as effectively. You might also see longer PR or QT intervals on ECGs, which are signs of slowed conduction and increased arrhythmia risk. In short, aging affects the entire cardiovascular system. These changes raise the risk of several diseases that can seriously impact quality of life. But with early detection, good lifestyle habits, and proper treatment, we can help older adults manage their heart health more effectively.